To start focusing on using hand sanitizer and scrubbing surfaces to stay healthy, but we pay little attention to that indoor air that could carry the coronavirus. Joining us with tips to protect ourselves is Dr. Sreek Cherukuri. Doctor, good morning. Good to see you.
Good morning. Thanks for having me.
Well, let's first start with the virus that hangs in the air. How much of it is it? And is this really something that I know people have said, nah, that's not necessarily true, but you're saying it is?
Well, I mean, what you said is correct. Back in March, we didn't know a lot about coronavirus, and we were focusing on surfaces, which is how other pandemics in the past, cold and flu viruses transmitted. So we were talking about scrubbing surfaces, washing hands, hand sanitizer, and even masks weren't widely recommended initially. We now know that the primary way coronavirus spreads is through respiratory droplets, which essentially means contaminated air. And the CDC acknowledged this as recently as October.
All right, so obviously the masks certainly are a way to prevent that kind of thing, but you're saying too that air purifier can do the same kind of thing, or at least help in that area.
Well, I think one of the things that's facing small businesses, big businesses today is how to bring back employees and customers safely in a COVID or post-COVID environment, and we have to focus on air quality. As you alluded to, masks can do one thing, but a very important thing, maybe the most impactful thing we can do, is how to keep germs out of the air and improve the air quality. So a combination of strategies that introduce outdoor air along with cleaning and preventing infection of the indoor air. As you alluded to, when possible, we have to open doors and windows to introduce outdoor airs, which would dilute any virus that's in the air. In terms of the indoor air quality, HEPA filters are a great start. They can filter down to 0.3 microns, which is great for allergies and coronavirus when it's trapped in droplets of respiratory droplets are amongst that size, but the actual virus itself is smaller. And so now the newest technologies combine HEPA filtration with UV technology that can actually kill the coronavirus. I personally am using a product in my waiting room called AiroDoctor, and it does that. It combines a combination of HEPA filter, two other filters, and UVA technology that can kill the coronavirus. And I feel like that will give the greatest peace of mind to business owners on how to keep communal spaces clean.
Right. Is it one that requires you to change your filter on a regular basis? How does that work?
Similar to home units, you got to change filters on a regular basis. Probably every 90 days, things like that. But the beauty, some of the systems out there require installation into HVACs. Some of these, like the AiroDoctor, is a plug and play, real easy to use. But we have to remember the key things: mask wearing when indoors, introduce outdoor air whenever possible, and then clean the air that we're breathing, because air is communal. We're all breathing the same air, especially in break rooms and things. We take our masks off to eat, and that's a very, very high risk scenario if it's crowded.
All right. Well, Doctor, thanks for being here. And again, where can people go if they're interested in the AiroDoctor?
It's AiroDoctor.com/US.
All right. Thanks for being here. We certainly appreciate it.